Today's topic, what's new in cosmetic dentistry? With us we have an expert on the topic, Dr. Leonard Smith. Dr. Smith, welcome back to the program.
Well, thank you, Randy, and thank you for inviting me to come back.
Now, before we get into today's topic, tell me a little bit about, for those who don't know you, who your typical patient is. What type of procedures do you do?
Well, I see really anyone that you could think of. And of course, I'm in Silicon Valley. We have a lot of engineers, but I have nurses, I have doctors, we have airline people, we have people of all walks of life, absolutely.
Now, you do dental implants, you do cosmetic dentistry.
I've become known in the region as a cosmetic dentist, and this encompasses all phases that you could think of that you see on TV shows like Extreme Makeover. Dental implants is a real specialty that I got into at the inception many years ago, and I do a tremendous amount of treatment because the fact is that these people watching out there need to have a clear choice in their health care needs and their provider. And the fact is that many people have to go to 2 or 3 different specialists.
You do everything under one roof.
And I do everything under one roof.
So you do the surgery?
Absolutely.
Okay.
Yeah.
Interesting.
And it makes it's so convenient. And when the folks come in and they meet somebody that they really like, then they don't have to go through the uncomfortable situation of, oh, you mean I've got to go there? Oh, I've got to go there.
Because people still don't like going to the dentist. Is
they
that
don't.
Right? Is that true?
Absolutely
but they
true.
like going to you, you say.
Well, they do, and because
fun over there.
I can do all those procedures, we become friends with the patients. We treat them the way we want to be treated. The fact is that if I was going to go to a dentist, I would want to find somebody like myself.
Now, in a recession, interesting thing you told me on the telephone, Randy,
Yes.
a sure bet is to invest in yourself. Expand on that.
Oh, absolutely. Well, the fact is that, for one thing, dentistry is one commodity that's never going to get less expensive. And when you have patients or people out in the workforce that are looking for new jobs, looking your best is going to be the one area that you can control. You can make that employer want you because you're going to feel better about yourself if you have health, function, and beauty of your mouth.
All right. You say people become more confident. That means if you change their smile,
Oh,
I'll quote you exactly, you change their life.
Oh, absolutely. Yeah, let me give you an example.
Okay.
I was in the grocery store the other day, and I was going through the quick line, you know, and this woman, the cashier, I thought, geez, she's in a bad mood today, and I was watching how she interacts with people.
Okay.
And then when I finally got up to her, and she hasn't looked me in the eye, she keeps looking down, her lips are tight, she just looks angry, upset, or just sad. Okay. And the fact is that I made a point to say to her, thank you for your service, you really helped me today. She looked at me, she was surprised, and she smiled, and my God, were her teeth not good. Her whole life revolves around her teeth and her poor smile and her poor image of herself. Now, that can be the same person working in any other industry. It can be an engineer, it can be a waitress, a waiter, it can be anybody in the service industry. And
so they're ashamed of their smile. They confide in you on the consult.
Absolutely.
These things?
I always say it's not about the teeth. Now, the teeth can fix a lot of issues, but it's not about the teeth.
What do you mean by that?
I mean that the fact is that people know that there's something that's just not right for them. They don't feel real good or upbeat about themselves when they go into a room. They don't really go in and look forward to being greeted by other people because they're kind of embarrassed by the way they look. Sometimes they put their hand over their mouth. Sometimes they just won't smile. We have to retrain people to smile.
So you see changes in their self-esteem?
Oh, it's like night and day.
Really?
It is wonderful. These people, and when I show new patients the befores and afters, they say, oh, well, you just did makeup and more and they look better. But I say, no, that isn't it. These people are smiling. They feel good about themselves, and they feel good about going out into the public in any setting, whether it's personal, whether it's business.
So it's not just for the wealthy, rich and famous anymore. I mean, it's become mainstream. Veneers?
I think we've established that years ago. The fact is that I have school teachers, I have bus drivers.
Do people tend to do this for a special occasion, fix their teeth?
Oh, absolutely. Like I say, we get all types of people for all different reasons. But let me give you some just typical reasons. My population of patients is 40 to 70 years old, 80 years old. Some of them are going to a reunion. Some of them are going to their 60th reunion,
All
you know.
right.
But some of them are the mothers of the bride. Some of them are the bride.
They want to look good in pictures.
They want to look good in pictures. Some of them are going out into the job market. Some of them, unfortunately, have been divorced, and you know, that's a reality.
Dating again.
They're dating again, and they want pretty, healthy, vibrant, young-looking teeth, and it is really true.
And you're a dentist. Of course you think the smile's important, though.
Well, I'll let you be the judge of this case. Now, here's a
okay.
here's a very pretty woman, and here's a
boy.
before, and she's an attorney, and the fact is that she's had these teeth all of her life. Now, I talk to her extensively the way I do with all my patients because I get into the real reasons that they're in the office.
So what'd she say?
She said that I just don't smile. I put my hand over my mouth. I don't feel good about it. I don't feel good about the way the teeth look. And can you help me? Well, after the patient tells me why they're in the office and what's really bothering them, and I ask a lot of probing questions because a lot of them are very emotional issues. They're not just the physical issues of the teeth.
Okay.
And they've been created by the teeth. So as you can see here, this is a pretty severe malocclusion or poor bite, crooked teeth that this lady's had, very yellow teeth. She's had that all her life.
She didn't smile?
She doesn't smile.
So she says that to you?
Oh,
on the
absolutely,
consult.
absolutely,
Really?
and
Interesting.
very emotional about it. She was means that she's very honest and very open, so that I can get down to the details of what I can really do for her, how I need to go about this.
So when you see this, by the way, patients in front of you, in your mind, do you go, wow, this would be a great case?
Oh, absolutely. I know where I'm going before they do, but the fact is that I have to know why they're there so that I can customize this treatment for their needs, desires, their wants. So what we did was what we term full mouth reconstruction. This is ceramic treatment. This is veneers, and we had to do all of her upper teeth and we did all of her lower teeth so that her bite meshes very well, which gives the longevity of the treatment. That's why it will last. And the ceramic treatment, the veneers, will give the beauty that she wants. So let's take a look at this after here.
Wow.
Now,
Doesn't even look like the same person almost.
no, it doesn't. And these people light up. I mean, this is an emotional issue. So let me tell you what happened after the fact with this. This nice lady emailed me pretty much weekly, if not every day, for the first 2 or 3 months. I mean, this is like changed her life. Every morning she gets up, she's brushing her teeth, she's smiling, she's loving it, she's looking forward to going out into the world. She's making new relationships. She's more confident in her
Just
business
because of her
place.
teeth.
Just because of her teeth. Now, she was down, she travels, and so she was down south. I'm in North California. She's in LA. A businessman, came across the concourse, and she saw him coming after
She's at the
her.
airport.
And she's at the airport at her gate, and so man's coming across, and she saw this man, and he kept this direct line towards her. He comes up, and he looks at her, and he says, I just had to come over here and say to you, you have a beautiful smile. Now,
right?
you saw the before picture. Do you think that ever happened before in her life?
In the after, she looks healthier. I think anybody looking at this would agree. She looks younger, but she also looks more refined or sophisticated.
All of
Just
those,
because of her teeth.
all of
Very
those
nice.
things, and that's why I say it's just not the teeth. Their whole persona changes.
More
And it's
confidence.
Absolutely more confident, happier. I mean, we're talking emotional happiness.
By the way, when these patients look at their mouths for the first time in that mirror,
Yes.
can it be emotional?
Oh, it's very emotional. And that's why I say it brings tears to their eyes. It brings tears to my eyes.
This is good stuff.